Welcome to the Neuro-Spine Preop Class. My name is April Hicks, and I am the Clinical Nurse Navigator for the Neuro-Spine Center. At the end of this presentation, I will provide you with my contact information should you have any questions. So let's get started. We want to welcome you to Roper St. Francis Healthcare and the Neuro-Spine Center, where our vision is exceeding expectations every day, and our mission is healing all people with compassion, faith, and excellence. The goals for today include preparing for the day of surgery, reviewing expectations during your hospital stay, and briefly discussing needs once discharged. Further instruction is given by our wonderful neurospine nurses post-surgery. It is important to know what surgery you will be having and why. Reasons include, but not limited to, degenerative disc disease, herniated or bulging disc, compressed nerves, osteoarthritis, compression fractures, or spinal stenosis, which is narrowing of the spinal canal. Our neurosurgeries include anterior cervical discectomy and fusion, or ACDF, posterior cervical discectomy and fusion, thoracic surgery, lumbar discectomy, lumbar laminectomy, lumbar fusion, and other procedures such as osteotomy, kyphoplasty, foraminotomy, and corpectomy. Now that you and your surgeon have decided that surgery is the best option for your condition, it will be beneficial to understand your spine. The diagrams to the right will help familiarize you with some of the terms that your care team might use. If you have a copy of the new surgery book, you can read in more detail about the anatomy of the spine, spinal disorders, and type of spinal surgeries. Your care team will consist of the following: your neurosurgeon, a PA or NP, a clinical manager, which is Sarah Richter, and our clinical nurse specialist, which is Shannon Woodwick, your registered nurses, patient care technicians, case manager, which is Jennifer DeWolf, and you also may meet with a physical therapist, occupational therapist, speech therapist, and the durable medical equipment therapist. Of course, you are the most important person of the care team. It's important to know your surgery date. 1 to 2 weeks prior to your surgery, you will be contacted by the pre-admission testing or the pre-op clinic to review your medical history, surgical history, and medication list. Lab work also will be done at that time if ordered by your surgeon. A follow-up appointment will either be scheduled prior to surgery or you will need to call to make an appointment. It is also a good suggestion to notify your primary care provider of surgery. You will also be given an order for your brace, either neck or back, as per the surgeon request, and then a discharge plan. Not everyone will need a brace. Your surgeon will let you know if you need one to support your spine and prevent unwanted twisting and bending movements. One of the durable medical suppliers will contact you before surgery with a date and time to be fitted for your brace that is convenient for you. If you smoke, please quit now. You may call 1-800-784-8669 or 1-800-QUIT-NOW for more information on smoking cessation. Most insurance companies require you to stop 6 weeks prior to surgery. Smoking is detrimental on our health, especially during and after your spinal surgery. Smoking after surgery will result in incomplete or delayed healing of the spine. It is also important to note no alcohol use 2 weeks prior to surgery. Please inform your healthcare team of any alcohol intake, because serious harm can result from alcohol withdrawal when not properly managed. Your neurosurgeon will want you to stop the following medications 7 days prior to surgery. They include non-steroidal anti-inflammatory drugs such as aspirin, Advil, Motrin, ibuprofen, Aleve, Naproxen, Mobic, Voltaren, and Celebrex. Also prescription blood thinners such as Coumadin, Plavix, Pradaxa, Brilinta, Xarelto, and Eliquis, and over-the-counter medications such as fish oil, vitamins, and herbal supplements. Please discontinue these medications as directed by your neurosurgeon. To lower the risk of infection, we want to make your skin as free of germs as possible before the surgery. Patients undergoing surgery have been shown to be less likely to get an infection by showering with a special germ-fighting soap like Hibiclens. We ask that you wash with Hibiclens soap the night before and the morning of surgery. If you do not receive a bottle of Hibiclens at the office, you may purchase it at a local drugstore, Walmart, or Target. Please do not eat or drink anything after midnight. You will receive further instructions as to what medications to take the morning of your surgery with a sip of water. If you receive Ensure drinks in the mail, please disregard. Do not drink them. Contacts, makeup, hairpins, jewelry, perfume, cologne, and or nail polish should be removed prior to arrival. And it's very important that you get a good night's rest. This is a list of what to bring and not to bring with you to the hospital. You want to bring a list of medications and allergies, your photo ID and insurance card, any assistive devices such as glasses, hearing aids, contact lenses, and dentures, a CPAP machine if you use one. You also may bring other items such as toiletries, pillow, blanket, phone charger, and loose-fitting clothes for discharge. And please make sure you bring your brace. Please do not bring any valuables such as jewelry or large amounts of cash, medications unless our pharmacy does not have it. Do not bring extension cords or heating pads as they are a fire hazard. And please no drugs, alcohol, tobacco, or nicotine products. This is a list of common non-formulary medications that our pharmacy does not carry. If you take one or more of these medications, please bring it with you in the original bottle. We will then send it to the pharmacy where it will be counted, barcoded, and administered by your nurse. Your medication will be locked in our medicine machine until you are discharged. Please do not forget your medication. Your medication will be returned to you prior to discharge from the hospital. It is important to note that as a patient in the hospital, you will be given medication under the supervision of your nurse. Do not take your own medication. As we see a continued decrease in the COVID-19 positivity rates, RSFH support person guidelines will allow 2 support persons at the bedside for all COVID negative patients. Support persons will be expected to wear an approved medical grade mask while in any RSFH facility and will be screened at the entrances for signs and symptoms of COVID-19. The policy is subject to change as determined by case prevalence. You can totally do this. So on the morning of surgery, when you arrive to the hospital, you should park on the outpatient or ER side of the hospital. You and your support person will be screened. You must wear your mask. You will then be taken to the second floor waiting room. The support person will wait in the surgical waiting room, and at that time, a nurse will come and take you to a room where he or she will perform an assessment, review your medications, start an IV, and complete any additional blood work if needed. You will be placed in a hospital gown and non-slip socks. You will be asked to remove certain items, and you will meet with your anesthesiologist as they are responsible for choosing the best anesthesia method for your procedure. They will usually allow one support person to wait with you in the room until you are taken back for surgery. At that time, they will ask you to return to the waiting room. Your surgical team includes your surgeon, anesthesiologist, a surgical assistant, an operating room nurse, and a scrub tech. Your healthcare providers are committed to providing safe, high-quality healthcare. After surgery, you will be taken to the recovery room or PACU. This area is a transition from operating room to the neurospine unit. The length of time varies between each individual, approximately 1 to 3 hours. You will feel quite groggy as you begin to wake from anesthesia, and a recovery nurse will be monitoring your vital signs and comfort level. The PA or NP will evaluate you in the PACU. Please note that family members should keep their phone close by and be on the lookout for a call or a visit from the surgeon in the waiting room. You will receive a call from the neurosurgeon to update you, or they will come into the waiting room and give you an update on how the surgery went. Once you arrive on the neurospine unit, your nurse will do frequent neuro exams assessing your strength and sensory function. They will also monitor your vital signs, pain management, look at your incision, and change your dressings daily. You may or may not have a surgical drain, but if you do, it's usually removed post-op day 1. You may experience a sore throat from the intubation tube used during surgery to help you breathe. If so, please let your nurse know and she can provide you with some chloroseptic spray. Providing a safe and comfortable environment, preventing and recognizing potential complications, and preparing for a safe discharge will take place on the neurospine unit. It is unrealistic to believe that you will be pain-free after spinal surgery. The nurse will ask you a comfort level on the pain scale that can be worked towards until you're discharged. Do not wait to tell someone if you are in pain. And please keep in mind that pain medication is not scheduled. Therefore, you must ask for pain medication if you are experiencing pain. It is important to discuss with your neurosurgeon prior to surgery pain medication options to help you feel more comfortable. Pharmacological management includes pain medication, either opioid and or non-opioids. Non-pharmacological management includes ice packs, which are fantastic, heat therapy, but not on the incision, deep breathing, relaxation exercises, and walking. And this is a picture of the pain measurement scale. The pain scale goes from 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. The pain medications that are usually prescribed are tramadol for mild pain, Percocet, Norco, or Lortab for moderate pain, and morphine for severe pain. Pain medication is a serious deal. The RN may need to hold pain medication if you become too sleepy after surgery. This is a safety measure to prevent the loss of your ability to breathe. Some of the associated side effects with narcotics are confusion, drowsiness, dizziness, and headache. Also, nausea and vomiting can occur if you take pain medication on an empty stomach. So your nurse will provide you with a snack prior to taking the medication. And the big side effect from the use of narcotics is constipation. So walking and adequate fluid intake will help reduce that risk of constipation. You also may be prescribed Flexeril or Xanaflex, which is a muscle relaxer used to treat muscle spasms. The main side effect of the muscle relaxers is drowsiness. Gabapentin may also be prescribed to help reduce nerve pain. Some of those side effects may be dizziness, drowsiness, headache, tiredness, nausea, vomiting, swelling of the ankles, feet, and hands. Tylenol may also be given while you're in the hospital, and then you can also take this at home once you are no longer taking the pain medications. Antibiotics such as Ancef is given postoperatively to reduce the risk of post-op infection. However, if you are allergic to penicillin or penicillin derivatives, they will usually prescribe vancomycin or clindamycin. Decadron is a steroid that sometimes will be prescribed by your neurosurgeon to reduce inflammation. Usually this is just given in 2 to 3 doses. There are several measures that need to be taken to reduce post-operative complications. The incentive spirometer is used to reduce the risk of post-op pneumonia. The nurse or patient care tech will show you how to use this. You must do this at least 10 times every hour while you are awake. And also, please take it home with you and continue to use it at home. SCDs, or sequential compression devices, are sleeves that squeeze your legs to prevent blood from pooling and forming a clot. They will remain on your legs before, during, and after the surgery when you are not walking. And at home, you will need to do foot pumps every hour to push the blood out of your legs. Stool softeners will help reduce the risk of post-op constipation. You will receive Docusate Senna on the unit and may need to continue taking this at home. Unfortunately, the stool softener might not work on its own. You may need to take a gentle laxative if you have not moved your bowels in 2 to 3 days after surgery. Early ambulation is key. This helps with moving bowels, urinary retention, and most importantly, your pain. Urinary retention can happen, so don't be alarmed if it happens to you. It is not uncommon for it to occur postoperatively. This happens due to anesthesia making our bladder sleepy, and your bladder does not want to empty like it should. Typical symptoms include bladder or lower belly pain or fullness, frequency but hesitant, feeling that the bladder is still full after urinating. So our protocol for urinary retention is we will bladder scan using a non-invasive ultrasound that goes over your bladder within 6 hours if you cannot void or urinate. If the bladder scan shows that you have over 500 milliliters in the bladder, the nurse will perform a one-time straight catheter. If you're unable to void in 6 hours after that, and a bladder scan shows over 500 milliliters, the nurse will insert a Foley catheter and contact the urologist and neurosurgeon. Therefore, a nurse will prompt you every 2 hours to get out of bed and use the bathroom. Safety is our top priority. Please call, don't fall. You are at risk for falling after surgery due to anesthesia and pain medications. Therefore, only appropriate staff will be able to ambulate you after surgery. The hospital policy states that all patients are at risk for falling. A bed alarm or a chair alarm will be turned on for your safety. Our goal is not to take away your independence, but to keep you safe. We do have medical equipment in each room, such as a rolling walker and a 3-in-1 commode in case you need them. So you do not need to bring your own personal walker or cane. After you are discharged home, someone will need to assist in changing your dressing for the first 2 weeks post-operatively. It is important to have good hygiene to reduce the risk of infection, so wash those hands. Incisions will need to remain clean, dry, and intact, and you will receive more specific instructions at discharge based on your surgeon's preference for showering and dressing changes. Walking is the best form of exercise. No strenuous activity, but stay as active as you can by walking. You will go home with 1 to 2 prescriptions, pain medication, and or a muscle relaxer. It is very important to take the pain medication as prescribed. Do not drive while taking pain medication. Do not take any non-steroidal anti-inflammatory medications such as Motrin, ibuprofen, Aleve, Advil, Naproxen, Mobic, Voltaren, or Celebrex for the next 3 months. These medications can interfere with bony fusion. Also, do not take aspirin products, fish oil, or blood thinners for 1 week after surgery. Also, you want to drink lots of water and eat fibrous foods and high-protein foods to help reduce constipation and to promote healing. Comfort care at home includes pain medication as needed, walking, which is your best form of exercise, ice packs, and heat therapy, even though not directly on the incision. And just a reminder to avoid alcohol and no smoking after surgery, as nicotine can interfere with the healing process. If you experience any of these symptoms after your discharge, please call your provider. Your incision, if it becomes red or swollen around the site, If you know any bloody drainage that's not alleviated by direct pressure on the wound or pus from the site, a feeling of hardness or fullness around the incision, and if the incision opens. Also, if you experience a fever above 101 degrees or chills, new numbness, tingling, pain that's not alleviated with pain medicine, or weakness in your arms or legs, difficulty with elimination, such as your urine or bowel, and unable to swallow liquids after neck surgery. If you experience difficulty breathing, call 911. If you have any questions, please call your surgeon's office for further instructions or directions before going to the emergency room. It is a great pleasure to welcome you to Bon Secours St. Francis Hospital and the Neuro-Spine Center. We are so ready to meet you and provide excellent nursing care post-spinal surgery. Jennifer DeWolf is our case manager who will meet with you, your family, or support person, usually the day after surgery. She will provide discharge planning services, counseling, community information, and help with any equipment ordered by your surgeon. If you need to reach her, you can call her at 843-371-0145. Jody Kempf is an athletic trainer who works at the Durable Medical Equipment office here at St. Francis Hospital. She is one of the ones that's responsible for fitting you for your brace. If you need to reach her, please call her at 843-606-7005. And again, my name is April Hicks. I'm the clinical nurse navigator, and you can reach me at 843-402-1553. Please feel free to call me with any questions that you might have. And also, if you did not receive a copy of the new surgery book, you may call the office or call me and we will mail you one. Thank you so much for watching this presentation, and the Neuro-Spine Care team looks forward to providing you with excellent patient care.